So I'm with Professor Angela Coulter. Angela, you talked about shared decision making. What does that term actually mean?
Shared decision making means clinicians and patients working together to decide on the most appropriate treatment for the patient. So the clinician explains the treatment options and the patient talks about their preferences and what they think about the options, and then together they look at the evidence on the pros and cons of the different treatments, and then they make a decision together.
And it sounds a little bit scary in the sense it might prolong the discussion quite a long time, but I think the evidence is that actually it doesn't, but it really does help the patient get to a decision they're comfortable with. Is that correct?
Yes, it's about having a really good conversation, but also quite an efficient conversation. We know that on average it may take up to about 2 minutes more to do it well if you've got a good information to support the discussion, but it needn't take a huge amount longer than a normal consultation. And the net result is much better because a more appropriate decision is made.
And you've been involved in this field for quite some time, and you've seen various different tools come and go in terms of helping facilitate this conversation. What's your recommendation to our viewers as to where to find some resources and further reading?
There are quite a lot of patient decision aids available now, and NHS England has quite a lot on its website. You can find them, unfortunately we still don't have one place to go and look. They vary. Some of them are just simple sheets, one side of A4 that can be used in the consultation. Others are much more sophisticated online tools that the idea is that the patient will be referred to those, and they might go home and look at them and talk to their family about what they think they might want to do, and then they come back to have a discussion with the doctor or the nurse to make an informed decision. So it varies, and it depends a lot on the condition, the complexity of the decision, and the patient, what they would find most helpful.
And my final question, Angela, you're a non-executive director of NICE. I presume NICE is in favour of this shared decision-making approach.
Yes, NICE is beginning to pioneer it. It's organising a collaborative which brings together lots of people up and down the country who are trying to do this better. And also NICE's guidelines are gradually shifting in a more shared decision-making direction, making it clear that for most things where there are options, you really do need to talk to the patient about it and find out what they think. So I think NICE could still go further, and I'm very keen to encourage them to go further and produce more decision aids alongside their clinical guidelines to help patients really understand their options.
Professor Coulter, thank you very much indeed.
Thank you.